I wanted to do a disclaimer here. The purpose of this webinar is not to provide advice on Medicare policies specifically or options specifically. What this purpose is for informational purposes only. Now, let me just read the disclaimer out loud. BEBRF does not provide advice on Medicare policies or options and has prepared this webinar for informational purposes only. You should consult your own Medicare advisor before engaging in any decision or transaction. I also want to point out that today's date is September 25th, 2021. Please note that while Medicare principles should remain the same or very similar, dollar amounts that I will talk about today will change over time. So, in other words, if you're looking at this a year from now or 2 years from now, the Medicare principles will remain the same, but the dollar amounts may be different in the future. Okay, let's go. Medicare can be a confusing alphabet soup of options. You're going to hear about Medicare Part A, Part B, Part C, Part D. You're going to hear about the F plan, the N plan, the G plan, hence the alphabet soup. My purpose today is to help you make sense of it all, okay? Remember, and this is very important, it is an insurance agent's job to make whatever product they're selling seem like the absolute perfect fit for you. If they're not doing that, they're not doing their job. But is that actually your reality? So what I'm hoping to do is arm you with the right questions to ask anyone who may be coming to you to sell you a Medicare supplement. One other warning, I always say beware the friends and family method of supplement selection. What I mean by that is you probably know people, your friends, your neighbors, your colleagues, your family members who are already on Medicare. And they will say to you, oh, don't worry about having to go through all that. Just get what I got. It's really great. Well, there's two problems with that method of selection. And sadly, that's the selection method that most people go with. But the two problems with that are, one, does this person use their Medicare enough to have a full knowledge of how it works for everything? If your friend is relatively healthy, they might not have used it very much and just found the little pieces that they've used very good. Which brings us to the second warning and reason for this warning is that your health situation, especially with blepharospasm and dystonia, is uniquely different from theirs, okay? So they're not going to understand what your special needs with regards to healthcare are. And always remember that your needs are different, okay? So if you have specific questions about your needs, ask your insurance agent that question. As you are wading through everything that you find out, keep a running list of the questions that are unique for you, all right? Okay, why are we having this webinar right now? I got a symposium in 2 weeks. Practically all my time is devoted to that. So why would I choose to have this particular webinar right now? Well, every year from October 15th through December 7th, it's called the annual election period. When you select a supplement to go with your Medicare, you're not stuck with that same supplement forever. Because every year during the annual election period, you can choose a different supplement. And that supplement will go into effect on January 1st of the following year. So I wanted to have this webinar before the annual election period this year, so it would be timely for any decisions that you're making right now, okay? Also though, be aware that changing supplements can have both benefits and or consequences. And I will try and shed the light on both of those sides of the equation, benefits and consequences, later on in this presentation. But go ahead and put that up in your mind, that change, you can change, but there could be benefits and there also could be consequences. Overall, we hope to give you, again, and I'm going to probably say this numerous times, the right questions to ask. Okay, the big number one question is, do pre-existing conditions matter with Medicare? We know from the marketplace, what we sometimes call Obamacare, pre-existing conditions don't matter. But is that also true with Medicare? All right, because they're two separate entities. Do pre-existing conditions matter? And the answer is yes, they do matter. And having a fairly serious disorder like blepharospasm can affect not only the kinds of premiums that you're going to pay, but also the kinds of policies that you can get at all. So, oh no, that's bad, right? Maybe not. The government of the United States is going to give you 3 gifts. The first gift comes on your 65th birthday. What that means is 6 months before your 65th birthday and all the way through to 6 months after your 65th birthday, that is called your free election period to sign up for Medicare. During that 1-year period, you can sign up for any supplement, no matter how extravagant its coverage is, without having to answer a single healthcare question. This is the gift the government gives to you upon your 65th birthday. You do not have to answer any healthcare questions. You can get any supplement that you want, and it won't cost any more because of any illness or disorder that you have. And that will, as long as you stay with that supplement, then that will remain constant. Your blepharospasm will never be a factor in. However, if you choose to change during the election period, then, and you're out of that 1-year window, then it may become an issue, okay? So that's the first present you get from the United States government. The second present you get is a retirement gift. Now let's say, for example, you decide to continue working past 65 and stay on your employer's insurance that they provide for their employees, all right? So you're not going to go on to Medicare at age 65. Well, if you decide to retire at 68 or 69, should you be penalized because you didn't take money from the government, basically through Medicare, when you were 65? And the answer is no, you should not be penalized for that. So if you work until, say, 68 and you decide to finally retire, you have a 63-day window from the time that you retire and go off of your employer's insurance to get the same option as when you're turning 65. In other words, they can't ask you any health questions. So, but the only catch is you cannot have ever signed up before for Medicare Part B. You have to sign up for Medicare Part B at that time and not before. But you have a 63-day window where you don't have to answer any healthcare questions. One thing to be aware of, there's one question that they can ask you that seems like a healthcare question, and that's whether you're turning 65 or you're in your retirement 63-day window, and that is, do you use tobacco? That is not considered a healthcare question. That is considered a lifestyle question, and it will affect your premiums. So I just wanted you to be aware that if somebody asks you if you use tobacco, they're allowed to do that. And then your third gift is your Medicare start day. Let's say, for example, you're turning 65 on this coming November 25th. Just pull that number out of the air. Your Medicare actually will start on November 1st of that month. So you get 24 days while you're still 64 that you're on Medicare. And that's great, unless your birthday's on the first day or the second day of the month. So let's say your birthday is November 2nd of this year, you'll turn 65. Because it seems kind of unfair that everyone else gets those free days when they're 64 years old for Medicare coverage that you don't, They've set it up so that if your birthday is on the first or second day of the month, let's say we're using November as an example, your Medicare will actually start October 1st in order to level the playing field for you, so you don't feel like everybody else is getting something and you're not. Just so you know that, okay? Those are the 3 gifts that you get from the United States government. Okay, let's talk Medicare. Okay, first of all, we need to talk about qualifying for Medicare. Just because you're a United States citizen and you're 65 years old does not mean you automatically qualify for Medicare. You must work 40 quarters of a year or basically the equivalent of 10 years, and they don't have to be all sequential. But you must work 40 quarters where you are paying into the Medicare system in order to qualify for Medicare, okay? Again, 40 quarters, the equivalent of 10 years, in order to qualify for Medicare. What if you're a housewife? I don't even know if that word is politically correct anymore, but it's the word that people are most familiar with. What if you're a housewife all your life and you never work? If your spouse is working and qualifies for Medicare, you qualify through your spouse. Okay, there are certain areas of employment where people do not pay into Medicare. Most commonly, teachers. Teachers in any state usually have their own funded version of Medicare, so they are not going to qualify for federal Medicare. They're going to qualify for whatever their state has in place for them. So also be aware of that. Before we dive too deeply into Medicare, I want to talk about the difference between a part and a plan. You're going to hear about Medicare Part A, Medicare Part B, Part C, Part D. You're going to hear about F plan, G plan, N plan, okay? Again, back to that whole alphabet soup of Medicare-related items. A part, for clarity, is just that. It's a part of Medicare. This is mandated by the government. This is a part of Medicare. A plan is some kind of supplement, okay? So if you say Medicare Part D, you're talking about a specific part of Medicare. Now, it might be sold privately, but it's a specific part of Medicare. It is regulated by Medicare. A plan, while having some federal regulations involved with them, is always sold privately, all right? Those are supplements. And there's one place in Medicare where parts and plans cross paths. Actually, there's 2, but there's a major place where they cross paths. And I will explain that when we get to this in this presentation. I've tried to lay this presentation out logically so that we sort of build on a scaffolding system so that it's a building block and everything that you keep adding makes sense because of what went before, okay? But I wanted to explain a part is part of Medicare, a plan is a supplement. Okay, let's talk about Medicare Part A. Medicare Part A is what covers your hospital care costs. Medicare Part A, if you qualify for Medicare, it's free. It's completely free. You get it. You don't have to pay anything for the coverage of Medicare Part A, okay? It's the hospital coverage. Sounds great, right? Well, it is great. It's free. What it covers is inpatient hospital care, skilled nursing care, hospice, and some home care, okay? But what doesn't it cover? It's not 100% coverage. What Medicare Part A does not pay 100% of, I pulled this chart, and sadly, all of the charts that I could find were 2020. They haven't published the 2021 charts yet, but these numbers are fairly close to what 2021 numbers are. Medicare, if you go into the hospital, let's do a scenario. If you go into the hospital and you're seriously ill and need to be there for a long time, The first 60 days, you are 100% covered by Medicare Part A, okay? From days 61 to 90, you have a copay, a hospital copay of $352 a day. From days 91 to 150, you have a $704 a day copay. So, and after 150 days, you're not covered for the hospital at all, okay? Medicare stops paying. There's also a way that you could at some point be sent to a skilled nursing facility, and it has its own copay, but which I believe is $176 a day. But as far as hospitalization goes, this is how you're covered with Medicare Part A. Now, let's just say you were in the hospital for 150 days and all you have is Medicare Part A, no supplement. The grand total that you would be billed is $52,800. Okay, that's a big chunk of change. So this is why we have supplements. Okay, remembering also, this is just hospital care. This doesn't include doctor visits in the hospital. It does not include prescription drugs in the hospital. It does not include materials that may be needed in the hospital. It does, like, for example, if you get an artificial joint replacement, it has, those are materials. It does not cover surgical costs. It does not cover the anesthesiologist. This is just the bricks and mortar building, okay? And food and the bed and those things. This is Medicare Part A covers that. One other thing that Medicare Part A does not cover is the emergency room. So be aware that that does not fall under Medicare Part A. Okay, let's talk about Medicare Part B. This is another part of Medicare that does cover the doctors, the office visits, outpatient surgeries, et cetera, et cetera, et cetera. This is basically to counterbalance the hospital. Medicare Part B is not free. If you want Medicare Part B, you're going to have to pay a monthly premium, and there's an annual deductible. In 2021, the monthly premium is $148.50, and the annual deductible is $203. This is out of your pocket, okay? The premium is taken off the top of your Social Security check. If you are not on Social Security, you have to pay the premium quarterly. In other words, 3 times 148, 4 times a year. What it does cover, it covers doctor's visits and services, outpatient surgeries and services, lab work, x-rays, preventive services, durable medical equipment. By durable medical equipment, that means things like wheelchairs that you need for your home, or a CPAP machine or something like that. Some emergency room services, and some home health care. Medicare Part B works on the 80-20 split. That's going to sound familiar to you because that's how your employer-based insurance works. It's often how Obamacare works, is you pay our insurance pays 80% and you pay 20%. But you know how when, let's say you're on your employer-funded insurance and it's got the 80-20 split, and you reach a certain dollar amount, and then the insurance comes in and covers 100% for you. Well, there's no out-of-pocket maximum cap in Medicare Part B. That doesn't exist. So let's say you have something fairly serious, like a heart attack or a stroke or something like that happen. If that happens, then your doctor bills and surgeries and anesthesiologists and medicines and materials could easily go to $200,000 in a fairly short space of time, of which you would be on the hook for $40,000, because that's 20% of $200,000. So there's no out-of-pocket maximum cap. This is why we have to have supplements, okay? So that's Medicare Part B. What A and B don't cover. Now, for some reasons, the government has decided that parts of our bodies don't need coverage. So things that are not covered under Medicare Part A or B are vision. Vision is not covered. Also not covered, dental. Dental is not covered in any part of Medicare. Also not covered, hearing aids. Hearing aids are sadly not even covered by most supplements. And then finally, not covered by Medicare Part A or Part B, your feet. Now, if you have a foot injury, obviously that would be covered under an injury. But if you have something like a need for orthopedic shoes or anything like that, it's probably not going to be covered by Medicare. One exception to that is diabetes-related neuropathies. Those may be covered, but otherwise, your feet are pretty much left to their own devices, so to speak. Okay, so let's talk about supplemental insurance. There are two kinds of policies, and every insurance salesman will make you think that theirs is the absolute best solution for you. So let's just take a look at how those two different kinds of policies work. The first policy is called an Advantage plan, and the second policy is called a Medigap plan. These are two different kinds. They work completely differently. And so what I'm going to try and do is break them down for you so that you can see the differences between the two, so you can start thinking about what kind of plan that you want to have. Now, I said we're in the annual election period. This is when you can change supplements. You're seeing commercials on television. You're being inundated with commercials on television right now about different kinds of Advantage plans, of different kinds of supplemental plans, about different kinds of prescription drug plans, or whatever you want to say. You're also being inundated in the mail. I don't know if you can see this or not, but these are just the Medicare offers that I have gotten in the last 6 weeks, asking me to take those, take a look at their supplemental policies for Medicare. I am myself on Medicare, so I get this information just like anyone else. And also, when you're turning 65, you're going to get 10 times that amount. So just be aware of that. So let's break these plans down. Let's talk about the Advantage plan. The Advantage plan came along later. The Medigap plan is what is really original Medicare, but the Advantage plan came along later, largely because people were finding the Medigap plans premiums too expensive. So they created the Medicare Advantage plan as a cheaper way to get your supplemental insurance. How does the Advantage plan work? Okay. I broke down what Medicare Part A pays for and what Medicare Part B pays for. The Advantage plan is called Medicare Part C. This is that one overlapping part and plan thing that I was talking about. If you sign up for an Advantage plan, it will replace Medicare Part A and B, okay? Whatever the rules are, whatever the coverages are for Medicare Part A and B, those go away when you get an Advantage plan, okay? You still have to pay the Medicare Part B premium plus whatever premium that you have for the Advantage plan, but it's got a whole new set of rules that you live by. They have, one of the advantages is that it does have lower premiums than the original Medicare supplements that were available, the Medigap plans, which I will cover next. Okay, you still have to pay Medicare Part B. If you are low income enough, there are programs that are set up to help you cover your Medicare Part B payments. So you may want to look on your state level for some of those. The Advantage plans can even have zero premium policies, but be aware that the lower the premium, the narrower the coverage is going to be. So keep that in mind, and I'll explain what that means going forward. Another advantage of the Advantage plan is they're all inclusive. They also include prescription drug plans, and will often include dental and vision as well, okay? They're all inclusive. That's probably, that and the lower premiums are the biggest advantage of the Advantage plan. They are similar to a regular health insurance policy. So there's comfort often in familiarity. So that can be an advantage to the Advantage plan. So if those are the advantages, what are the disadvantages? All Advantage plans are PPOs and HMOs. This means they have their own network of doctors that you use, okay? You cannot use doctors outside of their network. And anytime you need to go to a specialist, even if it's a specialist you've been going to for 10 years, at least the first time you go to them, once you go onto the Advantage plan, you'll have to get a referral from your primary care physician, and you have to have, everything goes through your primary care physician. Okay, so be aware, PPOs, HMOs, you have to use their network of doctors. They have their own setup of copays and deductibles, okay? You might have to pay $20 to go to your primary care physician as a copay and $50 to go to a specialist. It might not be that high. It might be higher, depends on the policy, but you're going to have your own copays. You're going to have copays for outpatient procedures. You're going to have copays for surgical procedures, etc. Another disadvantage is that because these are PPOs and HMOs, generally the coverage is limited to a geographic area. So if you're way outside your geographic area and something happens, it could be problematic. Now, certainly, if you live in Texas and you're visiting your daughter in Nebraska and you have a heart attack, certainly you can get treatment in Nebraska. But the reality is they're going to want to get you back to Texas as soon as possible to get you back into your PPO. Now, there are some PPOs that have representation nationwide. These are from the really big insurance companies. So that may not be a problem, but if you buy a policy that has a name like Texans Plus, which is an actual policy in Texas, and it's a zero policy, HMO, Advantage plan, it's going to be limited to Texas, okay? There's usually no coverage for foreign travel. So if you like to travel outside of the country and something happens to you, then you're not going to be covered by Medicare. They don't know Medicare in Italy. So you're not covered even if you return and submit receipts from whatever happened in Italy. So before you choose an Advantage plan, some very important questions to ask. Make sure, if you have to continue going to your injecting physician, you feel like that is the benchmark for all of your decisions when you're choosing your supplement, and you want to go with an Advantage plan, make sure that your injecting physician is a part of that network. If they're not a part of that network, and this is something that you cannot give up, you need to rethink taking a particular Advantage plan. Also, expect to go through your primary care physician to get to your injecting physician. All right, just some things to consider. And certainly there are really great Advantage plans. Okay, so let's talk about the other kind of supplement plan for you, and these are called Medigap plans. Medigap plans are the original Medicare supplements, and they have an alphabet soup of plans. There's an F plan, a G plan, an N plan, there's a C plan, there's an A plan, a B plan, you name it. There's a K plan, there's all these different plans, okay? What differentiates them is what they cover and what they expect you to come out of pocket with. The advantages of a Medigap plan One, there are no networks. You can choose any doctor you want who takes, you know, like let's say you sign up for an Aetna Medigap plan. You can go to any doctor who takes Aetna Medigap. You don't have to have a referral. You don't even have to have a primary care physician if you don't want one. You can just call the doctor's office, make an appointment, okay? And you're covered through your Medigap plan. Some plans have 0 copays and deductibles or consistently low copays and deductibles, okay? The only deductible that you should have to pay on most Medigap plans is the Part B deductible of right now in 2021, $203 a year. There are no geographic restrictions within the US. An in-plan in Texas is the same in-plan in Illinois, it's the same in-plan in Arizona. So that travels anywhere in the United States. You are also covered through most Medigap plans, and this is a question that you would ask of your individual salesperson, for foreign travel. Now, again, I mentioned that Italy doesn't know from Medicare. They don't. They're not going to recognize your in-plan in Italy. However, whatever you pay out of pocket in Italy, you can bring it back to the United States up to $250,000 and get reimbursed by your in-plan. And the good news about traveling outside the United States is that healthcare coverage is much, much less expensive in other countries, so that you're not, it probably won't amass to the kinds of coverages that you would, or kinds of bills that you would have in the United States without insurance, all right? Some other advantages to the Medigap plans: you have more freedom. You have, you get to go to whatever doctors you want that take your personal insurance. You have more freedom. You also have more overall coverage. And in order to explain that, I've got to explain how the different Medigap plans work. And I will do that after I talk about the disadvantages of the Medigap plans. The disadvantage, the premiums for Medigap plans are higher. You're going to pay for all that freedom, for the right to choose whatever doctor to travel overseas and have coverage. So you're basing your decision either on money or freedom. They are not all inclusive. They do not include dental and vision, although usually you can buy a little supplemental package to go with your supplement that's unrelated to the actual plan for about $20 to $30 a month. That will include some vision and dental. And they also do not include prescription drug plans. So you have to purchase a separate prescription drug plan, which is Medicare Part D, which I will talk about a little bit later, okay? Okay, let me kind of explain how the Medigap plans work, since I can't compare it to how Medicare Part A and B work, or the Advantage plan. The F plan. Why do I have a picture of a vintage Cadillac? I'll tell you, the F plan is considered the Cadillac supplement plan. The F plan is the absolute best Medigap plan that you can get. It pays for everything. All those things that Medicare Part A and B don't pay for, F plan pays them, including the Part B deductible. So in other words, except for prescription drugs, dental and vision, anything that happens to you medically and you need to pay for, you don't come out of pocket a penny if you have the F plan. Sadly, so many people were opting for the F plan that they no longer offer it as of a couple years ago. The reason I bring it up is so that I can use it as a basis for comparison. There are people who still have F plans today. If you got an F plan prior to them no longer offering it, you still have an F plan. You're grandfathered in, and that will stay with you. If you go into the annual election period and you think about wanting to try something else, be aware that if you go off of the F plan, you can never go back to it. So that's an important factor as well. So since we can't have the Cadillac plan anymore, what is the next best thing? The G plan. The G plan is exactly like the F plan. The only difference between the G plan and the F plan is the Medicare Part B deductible of $203 a year. So the G plan is still available. So that means, except for that $203 annual deductible, all of your medical expenses are paid through the G plan. Those daily copays for the hospital, gone. That 80-20 split, gone. Everything is paid for through the G plan, except for that Medicare Part B deductible of $203 a year. Okay, how much does a G plan cost? Probably when you're turning 65, it's going to be between estimated between $130 to $160 a month. So more by a good shot than an Advantage plan, which can have a 0 premium. But the average premium for Advantage plans is around $50 to $60 a month. So it's considerably higher, especially if you're on a fixed income. So what might be a better option? The most popular plan right now is the N plan. More people are getting the N plan as a Medigap plan than just about any other plan. Okay, so what's the difference between an N plan and a G plan? With an N plan, you get all that coverage that a G plan has, except you have to pay the Medicare Part B deductible. And anytime you go to the doctor, it doesn't matter what kind of doctor you go to, you are responsible for a $20 copay. Okay, a $20 copay. And that $20 copay pays for everything that happens in that doctor visit. Even if it's lab work, x-rays, outpatient surgery, whatever it is, it's all covered by that $20 copay, okay? One other thing that you have to pay under the N plan, if you go to the emergency room and you are not admitted to the hospital, you have to pay a $50 emergency room copay. If you go to the emergency room and you are admitted to the hospital, that $50 emergency room copay goes away, okay? Because you're covered 100% in the hospital, okay? There is one other factor that may come into play with the N plan. Medicare sort of prescribes to the doctors what they can charge for certain services, charge to Medicare for certain services. Some doctors are very highly specialized and are very highly regarded, and they may, with the permission of Medicare, charge more, a little bit more, and it won't be a whole lot, but it'll be a little bit more than what Medicare would normally pay. With the N plan, you might be responsible for that difference. It doesn't happen very often, but for full disclosure, I want you to know that that is out there. Okay, so that's the N plan. So how much does an N plan cost as compared? We said G plan was about $130 to $160 a month. An N plan with that $20 copay, which is probably most you'll ever be on the hook for, plus the Part B $203 annual deductible. An N plan costs between $80 and $95 a month. Okay. A couple of warnings. Be careful of plans with extra words. And what I mean, if we're talking plans, if it says, say, G Plan Optima or N Plan Gold, those extra words, Optima and Gold, should not be there. If they are there, what that signifies is that that is really an Advantage plan masquerading as a Medigap plan. So again, you will be subject to a network of doctors, okay? It might pay out the way a G plan pays out, but you're going to be subjected to that network of doctors. So be careful if it's G plan something else, N plan, silver, whatever. if it has the extra words, more than likely, it's an Advantage plan where you will be subject to a network of doctors. And I sort of got ahead of myself and gave you the premium range already. Okay, let's talk about Medicare Part D. This is your prescription drug plan. Okay, now remember, if you get an Advantage plan, the prescription drug plan is a part of it, so you don't have to pay a separate premium for that. If you get a Medigap plan, and they don't have prescription drug plans, so not only are their premiums a little bit higher, but you also have to pay the additional premium of the Medicare Part D premium. Okay, so how does it work? It is a prescription drug plan. Let me explain how the best way to find your Medicare Part D prescription drug plan. You can ask your insurance agent to do it, to help you do it, but it's easier just to search it for yourself and not worry that the insurance agent may have some relation to a prescription drug plan. Go to Medicare.gov. Okay, this is what the page looks like when you land on it. Log in and create an account. And you want to do this for several reasons. Okay. Once you, and you can see here, you've got a link to health and drug plans, and also at the bottom of the page, you've got a link to health and drug plans. You can type on either one, and you type that in, you click on that link, and then you will enter whatever drugs and prescriptions that you take on a regular basis. They'll want to know what you take, whether it's a generic or you take the brand name, what your dosage is, and the frequency with which you get it. This is all important information. Botulinum toxin is billed through your prescription drug plan, so you're going to have to enter that information here. Okay, so that's why getting the right prescription drug plan is so important. So when you get that, they will give you several plans to choose from. Okay, and there will be several factors that you need to consider other than the premium as to which plan you're going to get. So these factors include, do they have deductibles? How high are the deductibles? Generally, the standard deductible is about $300 a year. So you'd have to pay the first $300 in a year. That doesn't mean that your prescription drugs are going to be super expensive. Because the very fact that you're on Medicare and have a drug plan lowers the cost of your drugs. Okay, let me give you an example of what I'm talking about. I've been on Medicare for about 1.5 years. The one medication that I took prior to going onto Medicare, okay, was high blood pressure medicine. Okay, I took 2 pills to manage my high blood pressure. When I would go in with my old insurance before I went on to Medicare, I could get a 30-day supply of my blood pressure medicine, and it cost me about $35 for the 30-day supply. Okay. I got on a prescription drug plan, whether it's through Advantage plan or through a Medicare Part D. I have a $300 deductible. Okay. They've told me I will, if all I have is the blood pressure medicine, I'll never meet that deductible. But what do I pay now that I'm on Medicare Part D? I go to the drugstore. I use the drive-through pharmacy, and I go in. I get 90-day supply of my blood pressure medicine that costs $35 for a 30-day supply. I get a 90-day supply now for $18. So your drug costs do go down, even if you have a deductible. Okay, so I just want you to be aware that being on Medicare does have its advantages. The reason I pointed out that I do a drive-through pharmacy, because every time they tell me the amount I owe, I just start giggling because I'm so happy that I'm not having to pay as much, and the pharmacist at the window gets a kick out of that. Premium costs A D plan can cost anywhere from $12 a month to $35 a month, depending on what drugs that you're on. But generally not much over $35. So keep that aware. A botulinum toxin, as I mentioned, this is where you pay for that. And most importantly, the plans that you get information about on Medicare.gov are going to talk about the donut hole. Now, you may have heard about the donut hole, you may have experienced the donut hole, but you may not know what the donut hole is. So let me try and explain to you the donut hole and how it works, okay? Now, you're going to have a donut hole in your prescription drug plan, whether you get an independent Medicare Part D prescription drug plan or whether or not you have a prescription drug plan through an Advantage plan. They both have donut holes, okay? So for those of you who are completely unfamiliar with donut hole, you're scratching your head going, what is she talking about? Let me explain how the donut hole works. Oh, I've already stated this. Okay, let's talk about the donut hole. This is just a graphic image. There are no actual donuts involved. Okay, your coverage starts in any new year, obviously on January 1st. Okay. So your deductible resets every January 1st. The first part of the year, you have relatively low Medicare forced low payments, just like I have with my blood pressure medicine. Now, depending on what drugs you need and that you've put down that you use, okay, at some point, you'll have spent so much money on those drugs that you enter what is called the donut hole, okay? What that means is that you've spent more than they want to cover for a while. I don't know why. There's no logic to it, but that's what the donut hole means, which means your prescription drug costs while you're in the donut hole are going to go up, sometimes significantly, okay, for a period of time. So as it says here, you have less coverage. Getting to where the donut hole starts is based upon not what you're paying for the prescription drugs. It's based on the overall cost of the prescription drug, okay? So while you're in what's called the coverage gap, you are paying more money. Once you have paid all the money through the coverage gap, you enter what is called catastrophic coverage, which means that your drug costs go way, 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 way down, usually lower than what you were paying in the first part of the year, okay? I do not know why Medicare sets it up like this. I do not have, so don't put that in your Q&A. There's no logical reason that I can think of that they do this to patients. I can think of all kinds of reasons it benefits insurance companies, but I can't see why they do this to patients. So do not put that in your Q&A. I'm telling you right now, I've never been able to figure out why they do this to Medicare patients. But I want you to be aware of the Medicare donut hole. The importance of that when you're looking at those policies at Medicare.gov, 3 things to look for. It will estimate if you go into the donut hole. It will estimate when you will go into the donut hole based on the drugs that you have listed that you use, and it will estimate how long you'll be in the donut hole. And please look at this from the perspective of each of the recommended prescription drug plans. Some will be better offer better donut hole coverage than others. So that's why you want to be able to you yourself look at the donut hole possibilities for your prescription drug plans, okay? So that's important to look at. Okay, we had a little glitch with Medicare happen in on July 1 of 2020. A new rule went into effect, and I just thought I'd address it here. A new rule went into effect that said, if you got your botulinum toxin injections through a hospital, every time you got went in for your injections, your doctor, your injecting doctor had to get a pre-authorization through Medicare for your injections. This happened because there are a lot of doctors who were injecting cosmetically, who were billing it as both blepharospasm or migraines. Okay. Medicare found out and said, how can we prevent this? So they somehow deduced that this was happening mainly through doctors who are affiliated with hospitals. So that's when they came up with this pre-authorization rule. Now, where it gets tricky is that there are a lot of independent eye clinics that seem to be independent, but in essence, they may be actually affiliated with a hospital, even if they're not geographically located on the campus of the hospital. So that might be why that problem came into be. The most common error that doctors were making that were causing these pre-authorizations to sometimes be rejected was the form that you have to fill out for the pre-authorization required the listing of the specific muscles into which the injections were going. And while doctors are supposed to be the ones who are filling out the forms, probably nearly 100% of the time, it was an administrator in the doctor's office. And when this new policy went into effect, a great number of them would simply put the muscles around the eyes, and then they'd get rejected. And the reality is what they're looking for are descriptions like the pretarsal area of the orbicularis oculi muscle, and in the frontalis muscle, you know, the actual names of the muscles. That's what they were looking for. And once they became educated, things settled down a little bit. But for the first 6 to 8 months that this policy went into effect, I was getting numerous calls every week. Oh my God, I can't get my injections. And luckily I had a guy with one of the pharmaceutical companies who was an expert in handling this and talking to the doctor's office and getting that all straightened out. I'll be honest with you, I have not had a call with someone with a pre-authorization problem in about 3 or 4 months. So hopefully they've gotten that all ironed out, and now all doctors' offices actually know what they're doing with these pre-authorization forms. Another reason you should get a Medicare.gov question, you should create an account, because it makes it really easy to communicate with Medicare.gov. You can communicate with them through email. They also have a live chat feature that is active 24/7. In fact, that's how I verified a lot of the information for this webinar today, was, you know, things I thought I knew. I just wanted to make sure that I had it correct. So I would go on the Medicare.gov live chat feature, and we would just text message each other back and forth with my questions, and I would get an answer from a person actually within the Medicare system. Now, I said I would talk about the benefits and consequences of changing plans during the annual election period, which, as I've mentioned, every year, October 15th through December 7th. The benefits are, you might find a cheaper plan that has close to the same coverage that you have now, okay? The consequences are pre-existing medical conditions count. So probably you won't be able to get a Medigap plan, because Medigap plans cover so much more than Advantage plans do. If you're on a Medigap plan and you choose to go to an Advantage plan, odds are not good that you in the next election period next year will get to go back to a Medigap plan, because you have blepharospasm, which is a fairly serious disorder, okay? So think of it as, if you go to a more or a less expensive premium, you're probably never going to be able to go back up to the more expensive premium plan, okay? Just think of it that way. So there's benefits and there's consequences. And I wanted to help you keep those in mind. So now that is actually the end of my prepared part of this presentation. So I am going to look and see if we have any questions. Medigap plans only pay what Medicare plans cover. I'm not sure I understand what you mean by that, Darlene. Can you explain that question a little bit more? Medigap plans pay whatever Medicare doesn't cover, if that's kind of an answer. So those hospitalization daily copays that I pointed out in the slide earlier, the Medigap plans pay for those entirely. An Advantage plan will have their own set of copays for those, significantly lower, but they'll have their own set of copays for that, if that answers your question. If Medicare does not cover an item not allowable, will the Medigap plan cover it? Yes. If it's an allowable object. Since I've been on Medicare, the only thing that I have had happen that was not paid for, when I went in to get my lab work done, draw blood and so forth, they had me sign one form saying that they were pretty sure they were going to want to run a specific blood test that was not covered by Medicare. And so I ended up having to pay for that particular thing because Medicare didn't cover it at all. If changing companies that provide the same Plan G for a lower premium, does pre-existing conditions get considered? Yes. Yes. If you get your Plan G during, at some point, and maybe you got it because you were turning 65, maybe you got it because you were in that 63-day window. If you get that Plan G, but you want to change to a different company that also has a Plan G that has the exact same coverage, and you're out of that 1 year 65 window or that 63-day window, pre-existing conditions will matter. Medigap plans pay the 20% of what Medicare does not pay. That is correct. Okay. If you've been on a Medicare Advantage plan for several years, can you get, are you asking if you can get a Medigap plan? Well, not without answering their pre-existing questions, and then they determine if they're willing to take the risk on you. You made this very confusing topic more easy to understand. Thanks so much. Oh, you're welcome. I was afraid you were going to say even more confusing, but thank you. A very well organized. Oh, thank you. Thank you so much. I appreciate that. Some people are saying some nice things here. Let's see if there's any more. Excellent. Don't forget, your donations make programs like this possible. So please, if you can, donate to BEBRF. And thank you so much. And until next time, bye.